Hello to the SNMA, LMSA, and just greater universe when it comes to education, especially medical education. My name is Dr. Lovinani. I am one of the mentors for the Tour for Diversity, and I am joined today by Dr. Brittany Halford. We will be presenting the first step on the road to residency, our annual programming with LMSA and SNMA. You're going to see our magical slides now hit the screen, thanks to our lovely wizards behind the wall there. We are going to get started with today's first presentation. Um, we are going to do some introductions, then I will lay some ground rules. As stated again, this is a collaboration between LMSA and SMA. We've been doing this now for 5 years, and we're very excited to be here. My name is Levanani, again, mentor. I am in emergency medicine. I am currently the medical director at TriStar Northcrest Emergency Department. And a little snippet about me that you should know if you want to say you know me is I am an avid gamer. I'm trying to get my light level up right now on Destiny 2 and get some tier 5s, but I'm not there yet. Dr. Al?
I have no clue what that means. I love. So thank you, Dr. Anani, for introducing us to the life of gaming. Hello, everyone, and welcome. I am so happy to be here. I am Dr. Brittany Halford. I am an internal medicine hospitalist at Beth Israel Deaconess Medical Center in Boston, and I am also a core faculty member for our internal medicine residency program. And unlike the gamer here, I am a mompreneur. So I have multiple businesses, one of which I would love to share with you, which is personal finance for the medical professional. So we can talk a little bit more about that offline, but today we are going to talk about how you can be successful in your path to residency.
Exactly, y'all. And she don't let her undersell it. She's been part of multiple podcasts, so she can definitely tell you about how unplugging the microwave can save you some money. It's a thing. So, a little bit about this tour for diversity. We want to make sure we go over who we are and how you know that this is our mission. This is what we want to do during all times, 24/7, 365, no matter what the climate is around the world. Tour for Diversity in Medicine, our mission is to educate, cultivate, and inspire future physicians, dentists, and pharmacists of diverse racial and ethnic backgrounds by forming local connections in order to fulfill a national need. And there is a big need out there, y'all. So the reason we continue this year after year after year is making sure that we get folks from all kinds of backgrounds into the residency programs they deserve. I am now going to pass it to Dr. Halford again so she can introduce us to the next couple of slides.
All right, so here is your road to residency. We start today in our session 1, where we're going to give you the overview and general strategies. This is the bread and butter, what you need to know in order to prepare for residency. Then just 2 days later, on August 14th, we're going to teach you how to fill out that application so that you can signal and send the message to the institution of where you want to go so that they know that you are serious about being there as a candidate for their residency program. And then after that, we have a whole week of specialty panels. So this spans from anything you want to know, from internal medicine, emergency medicine, psychiatry, PM&R, ortho, ENT, all of the things. We have them for you. So this is the opportunity for you to ask your questions. This is an opportunity for you to connect with other people in that profession and maybe form a mentor to pick their brain so that you can be successful on your interview day. And thereafter, in February, we're going to teach you the important tenets of your rank list so that you don't leave it up to chance. We're going to also help you to better understand how to navigate this not only today, but also as you enter into residency. So talking about some of the challenges that you might face in residency and how to be successful. All right, so here's our agenda for today. We're going to go over a 4th year overview, and then we're going to talk a little bit about the match timeline, the NRMP data review, help you to understand what should and should not be in that letter of recommendation and how to ask for it appropriately, how to interview like a boss, and prepare your mindset so that you can be successful. We'll also cover personal statements and addressing any blemishes that might appear on your application. During your fourth year, you will start with scheduling your step two. Okay. And so here's just a quick rundown. You'll schedule your step two. And ideally, you will take that before you apply, but at least by the time that you're applying. As a reviewer of the application, I like to look to the step two to demonstrate that you have a strong clinical acumen and that you can perform well, especially now because step one is pass or fail. So this step is going to be critical. We don't want you to take the test before you're ready, but don't keep kicking that can down the road if you can get yourself there and have that score to present on your application. Then you want to schedule any visiting electives and sub internships. I love this as an opportunity for you to actually go to the institution that you think that you want to be a residency at and form those connections. Do never underestimate the power of creating a network. It can literally open doors and change your whole application review. Then you want to start to think about, how do you prepare for your interviews? Not just making sure you got the right suit and jacket and dress, but also making sure that you practice, setting up and scheduling those practice sessions before the interview day. You want to do your research and if you can, try to publish something within this period so that you can talk about that publication on your interview day. You want to get the letter of recommendations and also meet with your chair and other mentors to help to craft this package and to prepare for residency.
The drip can never be understated, but definitely not the highlight. And also, if you guys hear any loud noises, no, there's no construction at my house. I just live with two 4-year-olds. They're cute, but they're loud. Also, make sure to drop any questions you have in the chat, any comments. We are answering them. I believe I'm logged in. You'll see my that's actually my gamer tag, Love8218. I will put stuff in the comments over there, linked to YouTube. So if you're watching on YouTube, we can see your comments and we will answer them. So if you have any questions, let us know. All right, now to the thick of it. We're talking about a lot of stuff a lot of fourth years may know like the back of their hand, but it's just really important to go over it. We know there's someone watching this right now. This is their first step into like getting serious about the match. So obviously June 4th was a long time ago. ERAS opened. Same thing with Residency Cast, right? I'm an old head. I apologize if I say ERAS over and over again. I do usually mean both in both situations, but I understand that Residency Cast is a whole different thing. The good thing is between June, you have all the way till September for Residency Cast and ERAS for those applications to be submitted, so they can start being reviewed by the different programs. Now, what a lot of fourth years don't know up front is NRMP is different than ERAS/Residency Cast. ERAS Residency Cast is how you apply to a program. NRMP is how you rank and match with that program. So you do have to register for two separate things. Don't think because you're under ERAS that you're automatically under NRMP. That's not true. NRMP opens up on the 15th. Then between the 15th and February 2nd, by the way, right here, September 24th, programs can start ranking and reviewing those applications that came in. February 2nd, ranking opens. People will start now using the rank list and putting it all in there. And then it will finally need to be submitted and locked in by students by March 4th. That rank list certification is due. Then the week of March 16th, that Monday, you find out if you match or if you didn't. And then the 20th is match day. Hoorah, hooray, make sure you celebrate. So if you haven't already, take a picture of this slide. These should be all on your calendar dates. They should have alarms set for them so you know when they're coming and when they're not coming. All right, time for numbers, because we wanted to discuss with you why you should be listening to us. But we also wanted to bring a little rema to the situation, a little calm down, just to make sure you're not overthinking this. So people always wonder, hey, how hard is the match? This is fresh data from 2025. You can see here the match rate overall is in blue. Placement rate for all applicants is here in gold, and then placement rate for active applicants, people who had everything actually turned on and registered, is here in green. So overall, for USMD seniors, people entering the match, 94% match. Okay, so people, you don't have to worry too much. For DOs, 93% match. Where most people get into lots of trouble, and hopefully we can help at least people in our ilk with SNMA and LMSA increase those numbers, are those who have already graduated. We know it's harder, right? It's 46%. If you've already graduated, you didn't match and you're reapplying. 44% for DO. For US IMGs is 68%, so well above half. Non-US IMGs also well above half. So if you just smash everything overall and you're just scrolling through Twitter, 80% of people match. It has a pretty good match rate, and then gets placement rates or going somewhere even after the SOAP for active applicants is 84% in total. So 8 out of 10 are going to have no problem by the end of this. We're here now to try to help those last 2 out of 10. Unfortunately, just like a top 10 list, there's not enough programs for students, but we are doing our best to make sure our SNMA and LMSA students are not those ones left out in the cold. All right, so this is another piece of data taken straight from NRMP. We did not make up this graph, all right? We are getting the graph from the data. We're reading the paper so you don't have to, and bringing that to you. And we want to make sure that you guys understand why it's important for everything about to say. Placement rate is where you go in total. So Mike asked a question. When you match, that's that first NRMP. So 90 or 80% will match. And then by the time the SOAP process is done, 84% of people place somewhere. So it's just saying you may not have matched on match day, but there's a higher percentage after the SOAP as well. So just throwing that out there. Great question, Mike. They asked all the program directors, hey, what do you find most important when you're considering on deciding who is going to interview with you? Okay. 85% of program directors ranked the dean's letter and the MSPE 4.1 out of 5, how important it was. But look here, guys, letters of recommendation in this specialty, 84% of program directors said it's a 4.2 out of 5. You can look at this whole graph. It's tied with grades. It's tied with rotating. It's tied with personal knowledge. And you don't see steps anywhere on here, right? So when they're deciding like, hey, who should I give an interview out to? It is really important to have a very, very, very good letter of recommendation. And that's what we're going into next. Letters of recommendation, the ask. Sometimes it's easy, sometimes it's hard. You all know the big wig at your hospital that you know if you got that stamp, you would be good. But you got to figure out how to approach them and what to do with it. First and foremost, you got to give people advanced notice. We put on our slide here 6 to 8 weeks because the earlier you ask faculty, the more actively you can follow up with them. It can be hard, and even at this rate, right? Obviously, September is more than 6 weeks or less than 6 weeks away, but you can still ask now. We are putting this here on everyone so everyone knows to ask as soon as possible. For part of the road to residency, we've had to email a lot of attendings and faculty to help us with this project. And I'm gonna tell you right now, I think about 20% of people had an away message up of, I'm doing this, I'm doing that, I'll get back to you when I can. You don't want that when you're trying to get your letter of recommendation thinking, oh my God, they're on vacation for 2 weeks. How can I get this? So please stay on top of them. Provide clear instructions about how to return the letters. All right. Some attendings, if they're older than me, just want to write it, print it. Yes, they will print it and slide it to you and say, there you go. So don't assume everyone's familiar with ERAS and know how to do it. Most schools have like a person that faculty can get with and just submit everything to them, but please don't assume. And ERAS will be uploaded electronically via a separate email, so make sure they're just on it. And this is highly, highly, highly important. I don't care what adjective you use, ask for a strong, excellent, machismo, supercalifragilisticexpialidocious letter of recommendation. You want to leave no gap about how good you want this letter to be, because you want to be real with that person. You want them to be real with you. Great people can write terrible letters of recommendation. So yes, you garnered that courage to walk up to the chair of your department when they were on lunch break and ask for a letter of recommendation, and they said yes, and you feel great. and that letter of recommendations is 2 sentences long, I worked with love. He was I. That just tanked your whole application. So, hey, Dr. So and so, I loved working with you. It was great. Do you think you can write me a strong letter of recommendation for X, Y, and Z field? They know what that means. Again, use whatever adjective you feel is best, but make sure it's strong. And what a good letter looks like. Sometimes you can preview it, sometimes you can't. It should have a statement about how the attending knows the student and their ability to evaluate the student's performance. So what this means is, I worked with love. He is excellent. Excellent. I work with about 200 students every year in the ER, and he's in the top 10%, right? That narrows it down, and now I know where you're coming from. Now I know how strong you are. Overall summary: love was great with sewing, and for some reason, he had a very strong connection with all of my Black patients. It was really weird. Whatever they want to write, just make sure some ability is conveyed. There are some specific evaluation tools that are presented by the ACGME, core competencies that are for every specialty out there. If they can highlight that you already know some of those core competencies, then a program director can go, oh, great. Now I know that when they get in, they're going to be, as good as the second year, or so on and so forth. Also, make sure to have a discussion about the student's attributes that demonstrate why the student will make an excellent resident, yada, yada. Highlight all of their characteristics. And then a nice closing paragraph summarizing their performance, including the discussions and strengths. Now, there's another great question in the chat. It says, but I heard you can't see your letter of recommendation, so how can we know they actually wrote a strong one? Great question. You are not supposed to see your letter of recommendation. If I'm being real, and we are supposed to be real here on the road to residency, a lot of people do let you see the letter because they want to double check spelling, make sure your CV things were right, and make sure that everything is up to snuff. Most won't, but some will. So if you can, double check those things. And if you can't, just make sure you were extremely explicit about how strong or excellent you want the letter to be. Again, Dr. So-and-so, can you write me a strong letter for emergency medicine? I am really attempting to match. And if you don't know where you stand, throw them a ball. I'm really attempting to match, and I'm hoping that I'm in the top 30% of students you worked with this month. And that's why I'm asking for this letter. They can be like, whew, you actually top 40. So if you want 30, I can't write you that letter. And then you'll know. But at least you'll know where you stand. Dr. Halford, please jump in. If I'm lying, I'm flying. Let me know if what I said was true.
You're not flying. You grounded. So I appreciate all that you said, and I really like the adjective super fragilistic. Please, please do not. How do you spell that? I could not send that in an email.
Google.
But I agree wholeheartedly with everything that you said. One of the things that I think could help to differentiate you from every other person who might be asking for a letter of recommendation is helping to provide a framework. So saying a strong, whatever adjective you want to use there. And I love what Dr. Anani said, how do you characterize your performance compared to everyone else? And that also helps the writer to say, oh, dang, they were that good. I think that they were even better. And now you've triggered something that they can put that in your letter of recommendation. When I see that as a reviewer, when they say, oh, this was the top 10% of the students that I've worked with, I'm like, oh, yes, this is another comparison amongst your peers to signal to that residency program how strong you are. I also love the example that he said about giving a specific something. You were great at sewing or suturing. If you want to go into surgery, you show compassion towards this specific demographic. You want to give them something that you did well. Maybe you can say, would you write me a strong letter of recommendation? I really enjoyed the time that we spent on this patient doing this thing. You think I'm going to go and wait and reflect for 20 minutes about, which patient? No, I'm going to use that same scenario that you put in that email, and I'm going to write about that. You are giving me a memory. You are making my job easier. And that is how you get to help them to curate the letter of recommendation that you want them to deliver. So you may not see it. You may check the box that is blinded, but you've given all types of hints and clues in your ask that has already primed them for an excellent whatever machisimo letter of recommendation.
Excellent. Excellent. See, I'm grounded, y'all. And last, when it comes to letter recommendations, the content, some of them, especially some of the real old heads who write like 50 of them, may ask, as Dr. Halford said, a draft or some framework knowledge or information to put around it because they want to see what you're thinking. What patients are you going to pull? What situations are you going to pull? And they'll use that. Always provide a copy of your CV and personal statement with the request. Don't wait for them to ask you. That's anytime you were waiting for an attending to email you back, you were adding 48 hours minimum to your request. So just send them the CV and personal statement up front. If they say yes, just here you go. Here's everything up front. And you may want to send it with the ask. And they can be like, they may have said no, but looked at your CV and like, oh, this person's awesome. Okay, fine, I'll write it. And they'll get it done for you. This is another location to highlight meaningful, impactful experiences, review program requirements with the particular writer. What we mean by this bullet point is everyone basically does it nowadays, but some specialties really do it, have standardized letters of recommendation. If you want one of those standardized ones, sometimes, and don't, it's not a slight, they're going to say, hey, if you want to slow, as we call it in emergency medicine, only the program director or only the course director does the slows, but I will definitely write you a personal statement. So make sure they know what you want for them, and then they'll kick it on from there and take it from there. So we're going to stop here, take a deep breath. We did a lot about letters of recommendation. We're going to do a pulse check, just like you do when you're running your ACLS. We want everyone to reflect on everything we've said this far. Are you on point? Are you where you should be in this process? Are you falling behind? And then I'm going to take 10 seconds and I want everyone out there to write down, you don't have to share it, 3 people you are planning to ask for a letter of recommendation within the next 2 weeks. I'm looking at my clock. And you can continue to drop comments in the chat. All right. Y'all go and email those people. And then we're going to let Dr. Halford jump into the next session.
All right. So here are a lot of words on the screen, but now we're going to talk about personal statement. And just as you are seeing all of these words on the screen, that is what it looks like when we're reading your personal statement. And after you've reviewed, 10, 20, 30, 50 applications, you don't want to read the words on the screen, just like you may not want to read the words that we have on this screen. So we're going to teach you how to make them read it, how to keep them captivated so they read until the end, that when they're done, they're like, oh man, when you interview, your application reviewer is like, I really love this statement that you put in your personal statement. And what we also want you to know is that your first edition is not going to be the last. So we're going to take you on this journey of how to really craft that compelling narrative that is going to keep the reader engaged and help them to understand a little bit more about who you are. And I can say that this is going to be even a more critical piece now than it has been in the past, because as you know, the DEI landscape is changing. So how many institutions are reviewing applications, how the information that you provide identify who you are or what you might be interested in, some of that may or may not be blinded until they get to this point where they see that you can reveal yourself to that residency program. All right, so jumping in, I just want to take a moment for you to digest some of the words on the screen. I'm going to read a couple of phrases here, a couple of sentences, so that we are all on the same page. So this is the first edition of a real statement. So when I think about my future role in medicine, I envision being a physician that will face a broad spectrum of clinical scenarios. So when you are writing, I want you to ask yourself, okay, what did that statement actually tell me? Okay. Instead of narrowing my focus on a single specialty. Okay. All righty. Now we're going to move on to that third line. The best opportunity to both see a diverse range of patients and to address their concerns through hands-on procedures. How could this be more specific? How could these sentences help to really convey the message, the purpose of the statement? Then I'm going to move down towards the end here. I endeavor to be a positive force that can help to soothe patients. Again, how can we be more specific? How can we not just put words on the page, but how can we convey something that no one else can write? When I am reading these personal statements, I'm like, okay, that was generic. That was just like everybody else. It's generic, nothing memorable here. And literally, that's how we talk about the applicants. Oh, they weren't very memorable. You want to be memorable, not in a bad way. And we'll talk about some of the bad ways that you can be memorable as we go on. But we want you to be memorable in a good way. What is that something about you? Are you funny? Do you express humor? Are you witty? Do you love nature or reading or dance? We want that to flow throughout your personal statement. Next slide. So, when we're talking about the great characteristics of a personal statement, I always like to come up with frameworks or mnemonics to help me remember. So, we're going to say either pick team, as Dr. Anani highlighted. He's the ER doc. We need some access. Let's put it in a pick, okay? And if you're unfamiliar with a pick, it is a peripherally inserted central catheter that flows from your arm all the way in, okay? But in this case, we want your perfect picture. Your personal statement should be the perfect picture of who you are and why you're the best applicant for that program. So it's personal. It highlights something others have not experienced. And you want to be specific. If I talk about, and I'm going to share my personal statement that I wrote a portion of it with you, no one else could have had that same experience, right? And so we want it to be something that's going to be unique and authentic to you. The I, it identifies core values and your personality. So if you are someone who is witty and funny and humor is just like naturally who you are, build that into your personal statement. I actually talk to people, I'm like, oh, I love this phrase. This made me laugh when I read your personal statement. You want to leave that lasting impression. And then you want to connect it to your core values. Remember, this is a reflection of who you are. So you want those values to be embedded throughout your personal statement. A compelling narrative. You want to tell a story rather than just listing achievements. If we go back to that first example, thinking about, okay, broad spectrum of illnesses, I want to have a positive impact. Those are not compelling narratives. Those are general statements that anyone can use. You want to tell a story about yourself. You want to ensure that it captures the reader's attention. Attention is one of the greatest currencies now. Social media, we're scrolling. After I've read 10 personal statements, I don't want to read another one. But you want to hook me right in the beginning. So as you are writing your personal statement, giving it to people, maybe just that first paragraph to say, okay, did this one-liner, did this paragraph want you to read the rest of my statement? Asking your parents, your friends, just random people on the street. Hey, I'm at Starbucks. I'm writing a personal statement. Can you just tell me what you think about this first paragraph? To see if it actually creates this desire, this curiosity gap to keep them reading. You also want to ensure that it's career focused. So I'm an internal medicine doc. When I'm reading through a personal statement, I am able to identify who are the categoricals, who are applying to internal medicine, and who are those that are applying to radiology, anesthesiology, dermatology, and are just looking for a prelim spot in our program. It is that clear which specialty that person is going into by their personal statement. And then you want to make it concise and focused. As I highlighted in the first example, those were very broad general statements. That was not concise nor purposeful. You want to go through line by line. How is this helping to create that compelling narrative? How is this helping to give them a full picture, not just a snapshot of who I am and why I am perfect for their program?
On that note, Dr. Halford, when you say concise, there's an old adage out there that I would love your opinion on if it's true or false. Old adage is all personal statements, one page, no longer. Do you think that still holds today? Do we give them a one paragraph after the one page? What would you say?
Yeah, I give you a sentence after that one page. But if you only have a sentence and it's like, okay, why is the sentence just here? Try to condense it down. But again, we have to read so many applications. And if it's too long, just like when you're studying, like, oh man, I got all these chapters, all these pages to read in this chapter, we kind of feel that way as well. So I like to stick it to the one page, but if you cannot make it concise, make it complete without that paragraph, take that paragraph that's needed. I would prefer to have a personal statement that goes full circle, that is complete, than something that just ends abruptly to fit the one page.
All right, y'all heard it here.
All right, so here's 9 months later. 9 months later. So this takes some time. So just as Dr. Anani had you write down those 2 people who you are going to ask for a letter of recommendation, we want you to get started today if you have not already written your personal statement, because it takes so many drafts. And as you are sending this out to various people, you're going to get different opinions, and you have to be able to filter through all of that to craft the best personal statement for you. All right, so 9 months later, this is the new personal statement. There's no better calling in life than helping your fellow human being when they are at their lowest. Okay. Was that a good hook? It could have been maybe a little bit more compelling, but let's see where the story goes. Okay, let's read the next one. Growing up in New York, I was often exposed to the homeless and vulnerable populations of the city. Okay, now this is more specific. Now I know this person grew up in New York. Now I know that this person has paid attention to someone who typically goes unseen, someone who typically goes unnoticed, unacknowledged. And for me, that speaks volumes. That speaks volumes that this person has taken the time to actually write about homeless people and undomiciled in their personal statement. Okay. So now here's a connection, some at their lowest points of life. So that connects that first line, right? That first sentence with the second sentence. So now I'm starting to get a little bit of a picture here. As I grew older, I used opportunities to engage in the homeless through volunteer work. Very nice. Okay, this person volunteered. They gave their time, their energy to help others. It was this early exposure and the time spent that laid the foundation for my current career goals. Okay, so this was a formative experience for them that is now leading them to pursue emergency medicine, and this person is applying. I'm going to skip down to kind of this last area here where you see hypertensive urgency highlighted here. And you'll see it says, one day when a patient presented with hypertensive urgency, he drove them to the emergency room. So he's highlighting this formative experience where he worked with a nephrologist in the shelter. Although he was a physician, the nephrologist, he was not equipped or trained to handle emergencies. It was then that I realized I wanted to be the kind of physician that mastered resuscitation and could be counted on in an emergency, one that does not turn anyone away. And so that is a positive way, like a juxtaposition of, yes, he had this childhood, this kind of experience of seeing this vulnerable population that created a soft spot in his heart. And then he worked with someone who was a nephrologist, but he saw the limitations of their capabilities, which led him to a career path in emergency medicine. And here's why. So it brings it full circle. He is telling us instead of just, he is showing us instead of just telling us with words, like we can actually embed ourselves in that moment. Like, okay, this person's blood pressure is super high and this nephrologist can't really handle that in the outpatient setting. Next slide. So here is mine. Okay. So on July 11, 2006, Joel passed away. And I just want to stop there because reading that first sentence is like, okay, who is Joel? And why did he pass away? That's what I'm thinking. Why did he pass away? So one of the things that I like to do, whenever I'm working, whenever I'm writing, is how can you create that curiosity gap? Okay. So now I have to close that gap. But creating that curiosity gap keeps me reading, okay? And so you just want to make sure that you actually close the gap. And sometimes people close it all the way at the end, but there's a connection there, okay? So then, as his malnourished 2-year-old body succumbed to HIV on the pediatric unit of Korle-Bu Teaching Hospital in Ghana, I, a mere research student, could only gaze upon him helplessly. Okay, so it's taking them back to experience that I can only have. So I've made it personal, right? I've made this captivating narrative. I'm hooking them in. And you'll see I close it kind of down towards the end where I talk about, although I was unable to fill this void as a student, right, creating this full circle, I knew that as an internist, me applying to the internal medicine residency program with an understanding of public health, I could learn to provide comprehensive care that extends beyond my patient's illness. So there's a tie there. There's that connection. So you just want to make sure that you kind of craft it in a way that is compelling, that you keep the person's attention, and that it's personal. You can't supplant anyone else into this position, into this personal statement, because they're not going to be able to talk about it the same way that I can. So going through your perfect picture, first thing with personal, you want to ask yourself, is this something that only you could write? Okay. Then does it share a specific, unique experience? What traits shine through to the story? Okay. Compassion, empathy, hard work ethic, whatever it is. Would the reader feel they know you better afterwards? Okay, this I think is key, because after I read the application, I often feel like when it's crafted appropriately, that I'm excited to meet that person. I want to make sure that they match the expectation that they've created as I've gone through their application.
I agree. A great personal statement makes me feel like I'm meeting a friend for lunch for that first interview. It's like, I know you so well. Hey, come in my office.
That's kind of how I feel with social media sometimes. Like, I know you, but I don't really know you.
Exactly.
Nice to see you in real life. Yes. For the compelling narrative, does it flow like a story or not just a resume in paragraph form? And I would say that this is also really important with your letter of recommendations. And that's why I think the priming is going to be so critical. I appreciate that you'll send your CV and all of that, but I just don't want a regurgitation of your CV. I don't want to read that. I want to hear about that personal experience that you have with that person that they've shared, and they really appreciate it, so that they can highlight something very specific that we would not see elsewhere. And that's the same thing for your personal statement. You can take some of those pieces from your CV, but you want to add so much flavor and depth to them that they are right there, that they really understand why those are such formative experience. Then the C, captures attention. Is the opening line or paragraph engaging and memorable? Career focus. Does it clearly explain why you are drawn to the specialty and how it fits your long-term goals? And then lastly, concise and focused. Are the sentences purposeful and on topic? So, breaking it down sentence by sentence, what is the purpose of this sentence? Does it have meaning, structure? So a big message here with this slide is that we don't want your medical school personal statement to be the same as your residency personal statement. They need to be distinct. They should use different experiences, highlight patient encounters, really show the maturity of who you are and what you will become and how you will curate your career and what type of impact you want to make in medicine. Next slide. Okay, so we talked about some of these pro tips. And one of the things that was not mentioned is your personal statement should also help to explain some of the red flags. And we're going to talk about this a little bit more later on, but we want you to create the narrative. We don't want to speculate, oh, why did this happen, right? Tell us exactly why it happened. And not only why it happened, but also reflect on how you will prevent it from happening again in the future. And this will give you an opportunity. Of course, we don't want it to be the entirety of your personal statement, but you are crafting a narrative. And if you can weave that in with an explanation, then that will be a great way to prime us in the review of your application and to help us to filter some of the information that we're seeing. All right, so some things to avoid broad general discussions, just saying, oh, I like to do research, or I'm interested in health equity. Give us the specifics. Do not reuse your personal statement from medical school. Don't waste space explaining why you want to be a physician. Like when you graduate from medical school, you are a physician. So we want it to be, right, specialty specific. Don't rehash what's on your application. Like, give us more depth, give us more flavor, make it spicy for us. And then do give some context, but not excuses for your blemishes. We want to make sure that you've processed it, right? You understand exactly what happened and that you can move forward from that. Remember, spell check and grammar check, read it out loud, and ask others to review it. I sent my personal statement. I had 11 versions of my personal statement. I sent it to my best friends. I sent it to mentors. I sent it to my mama. I asked my mama to send it to her friends. Like I sent it to a ton of readers. And maybe I didn't send them the entire personal statement because not everyone's going to know everything. Maybe it was just that first paragraph. Like, did this first paragraph want you to read more and learn more about me?
All right, y'all. So we're taking a quick pause here. Y'all probably like 40 minutes on personal statements and letters of recommendation. Yes. Okay. Yes. This is what people remember you by. And we wanted to take a pause here, or I'm going to help with the pause here to tell y'all some inside baseball stuff. When we, specifically people in academics, not me as much, are fighting for y'all in those rooms, the step store is what it is. The grades are what it is. But the personal statement is what can be picked up and held and said, this is who we want in our program. That's why it's important. It helps us help you. So that's why we're pushing so hard. Do residency programs see your med school personal statement? No, they don't, Life with Jess. But we know a med school personal statement when we read one. If it's, I want to be a doctor because I want to help people and doctors are great. You graduate med school in 3 months. You a doctor. Like, we need specifics so we can feel that energy sometimes. So just throwing that out there. And now back to Dr. Halford.
So there was a question here by Sammy. So does MSPE trump grades? And, I think whenever you're considering your residency application, it is full package. So just like Dr. Anani highlighted, okay, that personal statement differentiates you from everybody else who's gotten honors, everyone else who has AOA, everyone else who's at this institution. It is something that makes you unique. And as we are maybe not using the same terminologies that we used to use as far as diversity, we still want a very rich culture within our residency program. And that is how you signal that when I meet this patient at the bedside, I'm not just going to see them as their nephrotic syndrome. All right, I got a patient, I'm on service now, and I don't know why they have acute kidney injury, but that's my own problem that I'm working through. That's top of mind here. So, and we want you to see that patient for who they are. We want you to understand the richness of their culture so that you can fuse that into your medical decision-making, so that you can fuse that into the treatment plans that you're prescribing. And with that, we can see, I can identify that this person is going to be able to see that patient past their medical illness because of these reasons, because of the experiences that they've had. So show us who you are. All righty. So that speaks to exactly here what we're talking about on this graph, which is frequency and mean, about the importance ratings of each factor considered in deciding who to rank. Okay, so your personal statement is going to be really important. All of the application, we're gonna score that before you actually come to interview day. Okay. And so you will be part of the A list or the B list, or however people are accepting or rejecting their spots in the residency program for that interview for that program. But when you show up, these interpersonal skills, your ability to make these connections is going to be very important. And how you can solidify that connection is to convey who you are. So I'm going to give an example here. When I am reviewing a residency application and for on the interview day, our program specifically pairs that resident with someone else who has that same interest. And so if you are interested in quality improvement, if you're interested in global health, if you went to Northwestern Medical School, that's where I did my medical school, we're going to try to pair you with someone who has something similar to you. So this is an opportunity for you to convey what is important to you, and we can help to connect you with that person. And we know that when we have some type of shared identity, we feel a different way about the person that we're speaking with. So this is a way for you to win on interview day and for them to see that you actually have interpersonal skills because you've already had that initial connection that you've shared was important to you in your application. So
to answer your question,
yes.
Oh, sorry, go ahead.
No, go ahead.
I'll say, and to give you numbers to back up what we're saying, Sammy, 64% of program directors gave your MSPE a 4 out of 5, or only 50%, that's a 14% drop off, cared about your class ranking, only gave it a 3.9. 46% cared about your grades and clerkships, gave it a 4. And 38% cared about your grades and your desired specialty, gave it a 4.1. But we always remind people, this is when it comes to who to rank. Okay. So like Dr. Halford said, when y'all showed up to interview day already, that's one bucket, right? Once you're done interviewing, everyone starts on the same page now, and then they rank like this. And that's why, as you were asking, Sammy, this is what comes into play. And as Dr. Halford is about to point out, why interpersonal skills in interview day is so important. 89%, 4.8 out of 5.
All right, so let's do it. Lights, camera, action, or whatever you have, a lights, webcam interview. All right. So preparation. I cannot really express and emphasize this enough. This is imperative. When you are practicing, you want to maybe record yourself, listen to yourself, leave yourself a little bit of voice note, start to acknowledge some of those things that you want to change. So for me specifically, sometimes I kind of have my head to one side, or I think because, something's going on with my neck here, but I only acknowledge that when I was able to visualize and watch myself. There are certain things that we do that we may not know. So I would encourage you to, use ChatGPT, maybe, say, hey, I'm going on an interview, ask me some questions, and record yourself on Zoom. Now, when we say practice, we don't expect for you to memorize the answers. And I just want to highlight how damaging it can be for you to actually have something that you are referencing when someone is asking you a question. One applicant that I was interviewing last year, and she was a Black woman. And so we were paired. I was very excited to interview her. But when I asked her to tell me a little bit about herself, I could see that her gaze shifted, not from where the little green dot is on her laptop, but downward, and that her eyes were kind of reading back and forth. And she shared, hi, my name is such and such, and I am applying to dermatology because blah, blah, blah. And I believe that I'm a strong applicant because of blue, blue, blue. And it was so rare. And it was strange and very off-putting because I could tell that she was reading. Especially, I didn't ask her a difficult question about her research. I just asked her to introduce herself to me. And you should know your application backwards and forwards better than the reviewer. So you should not have to reference anything, right? It should flow from your mouth in a way that it's like, okay, we're just having a conversation. So feel very confident and empowered in the words that you're going to say. And the way that you can do that is through practice, not memorization. Please, please, please do not memorize that the applicant did not rank well at all because she lacked those interpersonal skills at the beginning. It was just very awkward to hear her reading her introduction. All right. So professionalism from the start to finish. Okay. Remember that every single person that you are interacting with on your interview day, from the moment we turn on the cameras, like moment we let you into the Zoom room, you are on stage. You are performing. Okay. So that means do not show up late. That old adage that, being early is on time, being on time is late, and being late is unacceptable. You don't want to be unacceptable. You don't want to have any distractions in your background. You don't want to be talking to anyone, because what we're doing on the other side of that is we are all noticing every single applicant, and we write down things. Oh, it looks like she was typing on her phone, or she was disengaged and uninterested. These are things that we are using to rank you up and down on that interview day, because we can't see the fullness of who you are because a lot of it is virtual. So remember that you need to be professional from start to finish every single interview.
To answer your question very quick, Ivy in the chat, how would you answer that question? Tell me about yourself. I struggle with this a lot. It's different for each person, but a very superficial 101 answer that I can give everyone is it should be 3 phases: superficial cut, medium cut, deep cut. Hi, my name's Lavanani. I'm applying into emergency medicine, right? Superficial, they should know that. Medium cut, I'm Nigerian by background. Some might know that by my name, some might not know that. I'm from Houston, Texas. I really enjoyed my time out there. I'm looking for a climate similar to that. And then deep cut, right? I use one up top. I'm an avid gamer. That's not going to come across on my application. Or I actually really enjoy Pelotoning. Or actually, my goal is to watch all of the Marvel Cinematic Universe in order that they came out and in chronological order versus Twitter, right? Like, that's a really deep cut. That's not going to be anywhere in your application. So now you know superficial, medium, and now they can have one interesting tidbit about you to take away. That's a very superficial, easy way to always answer that question.
And Ivy, I would say if you don't know how to answer that question, ask your friends what they would say about you. How would they introduce you? Of course, they're not going to know your academic footprint, but what it would allow you to understand is, how do other people see you? How do you come across? What would they highlight as the things that matter most to you? And that's what we're trying to gauge. We want to know, like Dr. Anani said, okay, some of who you are. Like, I grew up in Flint, Michigan. I always highlight that I grew up in Flint, Michigan. And actually during my medical school interview, like, that was the only thing that I talked about, is how it was growing up in Flint, Michigan. Okay. That I surprise people sometimes because I create this cognitive dissonance. They have their own structure or mindset of what a person from Flint, Michigan could or could not or whatever. And it also opens up doors. Remember, every seed that you're planting is something for us to connect with on the interview day. So you have to guide them. What do you want to talk about during your interview day? And that is some of the things that you can use to introduce yourself.
Great point.
All right. Manage your time. Listen, I don't want to know about one thing for 30 minutes. Okay. So when I ask you a question, I want you to be concise. And then if I'm interested, I'm going to ask you more about it. And then, oh my gosh, so you mentioned that that is fascinating. Can you tell me a little bit more about that? So ensure that when you're answering questions, you give the summary version of it. And then they are going to pick and choose to explore, oh, that was great. Or actually, I want to know a little bit more about, the proteins that you used on this research project or that publication or whatever, So they're going to go deeper and probe a bit more if they're interested. Okay. You don't want a space that is distracting. A lot of people have the white background. That's perfectly fine. Here you can see this is my office, but it is clean. Okay. I have a couple of pillows. You see my artwork. You see some things. I don't have trash everywhere. So you just want to make sure if you are going to show your space, and I would actually recommend that you show your space and not have the blurred background. It's a little distracting when like your ear gets cut off as you're moving your head or whatever. So clean up the space. If you have no clean space, what I would do is just turn my desk around so that it faces a corner wall so that there's just white, on both sides. But I actually prefer to see a little bit of background. I think it shares a little bit of your personality, but you don't want it to be distracting. All right. So Dr. Anani could probably talk about this a little bit more. We got with the different types of equipment, but use the standard equipment. Okay. Test your mic. You don't want to be on the interview day and the mic goes out, because you want to use this new fancy mic that you've never used before. Use the standard stuff that works, right? And like don't complicate the process too much.
That's it. Don't complicate it. Use it. We're both using headphones today, so you can hear directly. You can never have to say, "Oh, can you repeat that question?" I have the fancy microphone here, but you don't have to do that. Everyone's a podcaster who does this a lot, so just use what you got. Make sure it works. That's all.
All right. Test run your equipment. Yeah. Try it. And this is really important why being early is important, because you can see if you don't get logged in or whatever, you still have time. You're not now showing up late or you're not anxious as you're approaching the interview. So definitely. Are you allowed to blur the background? I think that you are allowed to blur the background because those are your own personal settings. But Sammy, I prefer not to have a blurred background. I think it looks more professional and it is less distracting on the interview day, especially if you're someone who talks with your hands or moves a decent amount.
Agreed.
All right. So here are just some pros and cons, of like what you should do and what you shouldn't do. So good examples and bad examples. You can see here that under this bad example, you just have a talking head. The camera is a little bit too close. The shoulders are missing, and the camera is below the eye. So we're kind of looking at it from a lower view. So you want to just make sure that the camera is as centered as you can, have something in the background. You want to make sure you have great lighting. I think even under a bad camera, if you have really good lighting, it helps. Have your shoulders in the frame and try to have the camera at eye level. So if you can't have the camera at eye level because of your seating arrangements, prop the thing up, whatever you got to do.
Black and brown folk out there, buy the ring light. $20. Just do it. Trust us. Buy the ring light.
Okay, so this is something that I learned actually from this presentation. I would always, whenever I'm like walking, I would just have my phone this way. But if you turn your phone, right, the landscape way horizontally, then they get the full picture. They don't even know that you're on your phone. Ideally, you would not be using your phone on interview day. But if, things don't work, then you show up at the interview and we want you to still show up professional with the equipment that you have. So, turn it this way on your interview day if you have to use your phone.
Yes, phones are backups, but if you need it, turn sideways.
Ivy says she's currently looking for one on Amazon, a ring light. Yes, get the light. Okay. Presentation, you want to be conservative, you want to have business attire. These are, common sense, but common sense is not common. So let me just share a story with you of when this went wrong. When you are meeting with mentors in whatever capacity, you want to ensure that the first impressions are lasting impressions. I had someone who reached out to me on LinkedIn. She was interested in, she was a medical student and interested in internal medicine. And when we met, her shirt was like one of those oversized shirts and it just kept falling off. And then I got to see her bra strap. Okay, we're not walking on the street, right? This is an opportunity for you to potentially meet a mentor. And then she kept pulling her shirt up and over the shoulder and over the shoulder. And I don't remember her name. I don't remember the university that she went to medical school. All I remember is that this girl's shirt kept falling off of her. So you want to try on your clothes the day before. Make sure that you feel comfortable in the clothes, that they fit well, that you don't have to continuously adjust them, because that is a distraction. And you don't want to be the girl that people remember because your clothes kept falling off of you. Okay. Like literally, I remember nothing else about this girl except her shirt kept falling off. So be conservative, business attire, but also be comfortable in the clothes that you're wearing on your interview day.
Hopefully that
Uh,
answers the question in the chat.
Yes, yes, yes. Colors of attire not to wear. I say, allow your personality to shine through. I love yellow, so I always wear yellow. But if you don't want to wear a bright color because that's not your thing, then do you. But if you have something that makes you unique, I would definitely wear a yellow blazer on my interview day because I love yellow. And that could be a thing that actually I have connected with other students on, is like, oh my gosh, I love your yellow blazer because I love the color yellow. So just allow your personality to shine through, but you want to, whatever you wear, you want to make sure that it still fits that bucket of being conservative and being professional. And Dr. Anani says, wear the bottoms. You just never know when you might have to stand up or something. And I'm not going to stand up today during this presentation because I have on shorts. So do as I say and not as I do. But yeah, wear the bottom. Be dressed from head to toe as if you were really going on an interview. Maybe, ladies, you don't have to wear the pumps, but everything else, you want to make sure that you are dressed appropriately.
Exactly. Gets you in that mindset. And for fellas, black, blue, gray. Don't try to be fancy with the suit. Black, blue, gray. Rock that. Maybe the tie you can be a little, stand out with, but black, blue, gray. All righty. I believe this is where I take over. I slide in now with some of the growth mindset stuff here. So we're going to put this here. People's time is very important. We're already over the 1 hour mark. So I'm going to kind of push through it, but I want to talk about why we thought this was so important. We wanted everyone on this road throughout this whole process to change their mindset that 240 on step 2 equals do whatever I want. And if anything below that, I'm not going to make it, yada, yada, yada. When you're in that fixed mindset of I have to do this or only this matters, you're not going to be able to change out of it. And as crazy as it sounds, we can feel that on the interview process, right? We want you to have a growth mindset through this entire process because some people watching this are going to have to shift what they're doing in the middle of interview season. You're going to get asked a question that we want you to highlight, acknowledge, embrace your weaknesses, but show something else. Don't stay or try to hide from things that aren't true. We want your brain to be able to think on the fly and learn. So as we go through this, if you've never heard of a fixed mindset, intellect is fixed, cannot change, only concerned about the results. You want to look smart all the time, and you're going to avoid anything that's going to disprove your smartness, right? You're not going to leave your comfort zone. That does not work when everyone you're talking to is where you already want to go. They're already above you. We want you to have that growth mindset where it's like, you know what? I think I know where I am right now, but I know with more time and experience, I'm going to get better. When I'm a resident under your tutelage, I am going to learn how to do X, Y, and Z. I'm concerned about the process of learning. If they hit you with one of those red flags in your application, you hit them back with, this is what I learned and this is how I improved. I am willing to venture out of my comfort zone. You want me to be the student that rotates at the away rotation site? I'm going to be able to do it because I want to meet those people and talk to people like that. You are going to show them that you're continually moving upwards. You are continually growing. One of the things I like to do about this mindset and why it's so important, it grounds you before an interview. So there's a great anesthesiologist out there. He's going to be the moderator for our panel, which is coming up soon. We're going to have the dates coming up. Dr. Stephen Bradley, Twice Daily Until Symptoms Resolve. He has an album, mindfulness album. It'll get you right. It'll center you. They'll have you thinking you're in a spa somewhere at the Four Seasons. But you need to do it because when you sit in front of that light and that camera that we're all going to have on those interview dates, and that program director at your dream program hits you with so please tell me why you passed step 2 by 2 points. You don't want to be stuck. All right. And you want to show them I'm able to move, I'm able to grow from this. And this is why you can trust me in my academic process. So look at these 2 kids, right? You want to teach someone who you think is going to like learning, even if they're starting at a lower position, quote unquote. So again, some head speak to kind of remind yourself, I don't understand this yet. I'm going to try a different approach. All right, I applied to 10 programs and this specialty is not working. Well, maybe I need my backup. You need to be able to move at all times. So again, we've gone through your hour, talked about growth and fixed mindset a lot. Here are some sentences if you can't get that. I learned from feedback. I'm inspired by others. Failures offer opportunity and growth. That's the mindset you want to be throughout all of this. Not I give up. I had one interview. I'm not doing anything else. I'm avoiding the challenges. I'm not going to email program directors or things like that. That can get you stuck, especially when you're fighting against thousands of other people for a spot. All right. Last but not least, what I know a lot of people are probably here for, addressing blemishes. Be proactive in addressing obvious blemishes in your application, right? I don't need to know that you had to retake the in-service exam for surgery if it's not on your MSPE, right? If it's on there, then great, address it. But if you got an honors afterwards, who cares? But the ones that are glaring that you know I see, give me a reason to interview you and not leave you on red. All right. So you need to address those immediately. Demonstrate how you learned and grew from those experiences and how you're not going to make them again. A big one here is for people who did not match the first time and are reapplying. I'm not going to say it's mandatory, but it's kind of a gold standard and it really helps. If you can prove that you already took step 3 and you passed it and you learn from other things like that and you're ready to go, that helps address a big blemish for some people. They're like, you know what? All right, they just need a second chance. Discuss what resources you may need. Again, they don't want to think, man, if I get this person in my program, I got to go get a whole new GME office and HR department. But you just want to say, I need time to think. I need time to study at least 2 weeks before tests, things like that. And remember, you are more than your blemishes. No one's perfect. So don't just write a sob story full of blemishes. They were one thing, you grew from it, you moved on. If one passed step 2 by a couple of points, should it be addressed in the personal statement? Ivy, I'm not going to lie to you because we don't lie here. It depends on what you're applying to. You applying to ortho and you have passed step 2 by a couple of points. I need to know why, and I need to know why I need to interview you because everybody else in this same pile of applications passed step 2 by 13, 14, 15 points. You got to give me a reason to put you in the same boat as them and not leave them on the side. So it just depends. Can't lie to you about that. All
Yeah.
right.
Oh, go ahead.
Go ahead. No. Go. This is important.
No, you're going to talk about it, I think.
Okay. Dealing with blemishes, not addressing blemishes, this is very important. It lets other people do narratives. We've sat in those rooms where we knew somebody and they're like, they didn't pass step 2. They're not good at learning. But we know you're more than that, right? Maybe the grandma died. Maybe you took step 2 on 3 hours of sleep and they didn't know that, right? And you can say, well, look at this test where I had 8 hours of sleep. I blew everyone out of the water. Don't let us make up our own stories, right? Give us the ending that needs to be there. Away rotations and networkings create the best advocates. Again, you want people in those rooms where your application is to say, forget that blemish. I guarantee you they're the best ever. And again, give context, not excuses, not excuses. Grandma passed away is context. Grandma passed away, period, sounds like an excuse. Grandma passed away and I didn't study because I fell off. I've learned from this. I've taken accountability. Here's proof that I won't do it again. What could you have done differently? All of that knowledge. All right. So we're about 10 minutes over, or 7 minutes at this point. These, drum roll, are all of the specialty panels and their times for the week of August 25th that we are going to go one by one. When I tell y'all we have some heavy hitters out here, obviously we have Harvard on here today. There's lots of Harvard in these panels. We have program directors, associate program directors, fellowship directors, people who are ranked top 10 in the positions in Atlanta, people who work all over the place. You want to join your specialty panel that you see here. Take a picture, share it with your friends. You're probably asking yourself, how can I join? We will have the links post in each organization's link tree, aka their bios, coming up by the end of the week or next week. We don't want them out too early because, you know, some people online be doing some sketchy stuff, but we promise they will be posted. You will get graphics, you will get faces, and we want you guys to show up with great questions. Sammy's in the question, no radiology, question mark, question mark. I'm not going to lie. We tried to get radiology. We hit them up. This year, no radiology. We've had them before in the past. We still know people we can try to connect you with on the off ski.
Yeah.
But on slides, on PowerPoints, recorded. Difficult this year, but don't think we're dropping all radiology applicants. Please still reach out to us as needed. And remember, you still got to do that prelim or that intern year. So you may want to still come to a couple of these other panels.
Yeah. Yes, Sammy. If you're interested, you can hit me up on IG. I actually have a friend who is doing radiology as a radiologist who can share. And one other thing that I wanted to highlight with the addressing blemishes here is use that as an opportunity to ask your questions. So if you know that you need this certain support, I don't know, whatever it is, then ask that during the interview. How do you support residents who fill in the blank, or can you please share a little bit about the structure of your program, about wellness initiatives built into the residency program, whatever it is that you might need so that they can answer those questions, those specifics about the program. Because remember, you are interviewing them as much as they're interviewing you. So you want to get what you need out of that interview day. Oh, thoracic surgery.
Great question.
I can't think of anybody.
Yes, they're actually going to be combined with our general surgery. That should be general surgery and specialties. In our flyers and graphics, we'll say that Dr. Minerva Arbenes is handling that. She always has one of the greatest CT surgeons ever. He usually joins her panels, and I'm pretty sure she's working on him right now. But Dr. Halford recommend hitting up that direction. So hit up her IG to reach out to Dr. Halford right there. You can send her a message there. Also, okay, so we're wrapping up. Again, lots of your time. Please, right now, we've taken an hour of our time from our children and family. You can do us a great benefit by just taking this right here. Oh, I promise there's probably somebody watching on their phone right now that's like, Dr. Nani, I can't take a picture of a QR code if I'm on my phone. Like, y'all should be thinking about this. Well, how about the link in the chat then, right? You can go right there. I'm sending it out there. Please click join when applying. Make sure you put all of your application things on the calendar so everyone knows what you need to be doing. Attend our specialty panels. Schedule your mock interviews with your mentors. If you want us to help you with some mock interviews, reach out to Tour for Diversity. I cannot post like that. I'll try again. Tour for Diversity on IG and Twitter. Reach out to us. We'll get you. Also, you can reach out to myself or Dr. Halford, and we'll kind of point you in the right direction. Forward your CV and personal statement to people. Attend residency fairs, virtual or in person. I mean, it's not like the LMSA convention isn't coming up this September in a couple of weeks. You can go there, attend those residency fairs. It's much, much appreciated. And again, please do our post-program survey. I'm trying to post the form in the chat. The Google form requests access. It should be open. All right, I will make sure that gets opened up to everyone. It should be open as long as you have the link, which Google asks questions.
Oh yeah, it's not working. Dr. Nani, you're breaking up a little bit.
If anybody has any other questions, please feel free now in the chat.
So I see Ivy is yeah, Ivy's asking for the link.
Yes, I'm trying to put it in the chat, but it keeps saying failed to post, and I'm not sure. You know what? My phone can do it. This is why you do. See, guys, phones, backups, like we said, right? I can go straight to the link on the video and post it there. I'm just going to make sure that everyone gets it. You got to go to all these different things. And I'm doing this live on camera now. So now there's extra stress with it, but I can do it.
If you all have any questions about anything that we've spoken about, please drop that in the chat as well.
I'm sending it to myself when you're the one live chatting. Go there, go there, change to that one.
I would love to know what specialties. So I know there's some people for radiology here, thoracic surgery. What other specialties are you all applying to come this fall? Internal medicine.
Yes,
Ivy
did
says
we get
internal
the right
medicine.
number
Okay.
of things? Oh, so she's going to be on your panel, it looks like. Oh, look at all these people requesting forms.
Family med. Nika says, if you screenshot on your phone, then go to your photos and press and hold the QR code, the link will show up. Love that. Thank you for sharing the tech. I did not know that. Okay, so Atalo Family Med. Don't kill me if I can pronounce all the names. Dr. Dada OB-GYN, Amanda Emergency Medicine, Alexandria Anesthesia, Life with Jess OB-GYN, Mike is IM. All right, so I look forward to seeing all of the IM people at the panel. Feel free to reach out to me on Instagram or LinkedIn. Tariq, General Surgery. And this is also an opportunity for you all to connect with each other, So look at people who are doing the same specialty, applying to the same specialty as you, because you can say, okay, let's do a mock interview together. Let me craft my introduction. What do you think about this? This is an opportunity for you all to share wisdom.
All right, everybody should have it. The QR code should work. I changed it to responder view, anyone with the link. So if you have the link, it should be there. Hopefully it all shows up. I'm going to copy it again. Someone else said link. I'm link copied. It may be too that, the link to the survey up there. All right, so somebody else saw it. Good. I was going to say maybe it's blocking because it's too long, but I did put it in the chat on YouTube. I can see it on my phone at least. So hopefully everyone got the link to that survey. And if you don't have it, again, hit me up on IG, or you can go to the Tour for Diversity Twitter. We will send that out there again so everyone can have it. And I'll make sure it's open next time so I don't have to give access to 85 people sending me emails. But I do appreciate that because it made it go really, really quickly. All right. And this is the greatest showing of a growth mindset you will ever see right in front of you live. Did not fluster, did not get stuck with it. We said we're going to work through this. We're going to grow. So thank you, everyone, for joining us. It has been great. It's been great listening to all your questions. We have another session in 2 days, and then we have all of the panels, again, that will be given to everybody. It should be a great time. We are here for you guys. Ask us the questions, and please, for the love of God, get started on those personal statements. And if you were like me and have that blessed with melanin Nigerian complexion, ring lights, Amazon, they will be delivered to your house. All right. For myself, Dr. Lebanani and Dr. Alford, thank you for joining us. Thank you to the SNMA and LMSA for sharing your students with us. And we can't wait to see you guys on the road moving forward. Have a good night. Bye-bye.